The distressing reality is that email reminders claiming the flu vaccine has heart health benefits did not lead to an increase in vaccination rates in a significant study conducted across the U.S. This study, carried out by researchers at Kaiser Permanente, stands out as the largest randomized trial of its type to date, encompassing a staggering 3.6 million members. Participants who received an email highlighting the heart protective qualities of the flu vaccine, which is also known to lower the chances of hospitalization and death, exhibited vaccination rates that were nearly identical to those who received a standard reminder explaining the general benefits of getting vaccinated against the flu. The intriguing results stem from a vast study spearheaded by Kaiser Permanente, which is thought to be the largest individually randomized clinical trial ever performed globally. A significant piece of research was featured in NEOM Evidence and concurrently presented at the European Society of Cardiology Congress in Madrid, Spain, in 2025. Dr. Ankit Bhatt, the lead author and a research scientist at the Kaiser Permanente Division of Research, emphasized the vital importance of increasing flu vaccination among the public. He pointed out that this goal is particularly crucial for individuals with pre-existing heart conditions, as evidence suggests that the vaccine can significantly reduce their risk of severe complications, hospital admissions, or even fatalities. The trial, dubbed the KP Vaccinate Study, Kaiser Permanente Vaccination Improvement with Nudge-Based Cardiovascular Targeted Engagement, aimed to compare the effects of messages focusing on cardiovascular health against standard communication methods to encourage flu vaccinations among the broader population. This comprehensive study included over 3.6 million patients in 2 Kaiser Permanente regions, Northern California and the Mid-Atlantic states, who had not yet received their flu vaccine as the new flu season was kicking off. Email reminders were dispatched to participants from September to November 2024. By January 1, 2025, approximately 32% of the Kaiser Permanente members who received the reminders had received their flu shot. Notably, no significant differences in vaccination rates were observed between those who were sent 1 or 2 emails focused on cardiovascular health and those who received the standard reminder message. The researchers concluded that their study successfully demonstrated the feasibility of conducting large-scale assessments of behavioral interventions within existing healthcare systems. Alan Go, another key researcher from the Division of Research, remarked on the collaborative effort of multiple teams within 2 distinct healthcare delivery systems to leverage existing clinical frameworks for this significant study. He noted that this successful approach lays a solid foundation for future investigations into other behavioral health interventions. Building on the foundation of previous research, one study conducted in Denmark, which involved emails emphasizing the cardiovascular advantages of the flu vaccine, revealed that such messages prompted higher vaccination rates among residents who had experienced heart attacks. In this new study at Kaiser Permanente, researchers dispatched email communications to a more general assembly of members to determine if this strategy carried over to different populations. Dr. Bhatt clarified that the Danish study indicated that recipients of emails highlighting cardiovascular benefits were indeed more likely to get vaccinated compared to those who received other types of vaccination messages. The recent study thus aimed to test the relevance and effectiveness of this messaging strategy among Kaiser Permanente members. In the new study, each participant had the opportunity to receive up to 2 reminders about getting their flu vaccination. Participants were divided into groups. One received 2 cardiovascular-focused emails. Another received 2 standard messaging emails. A third group received 1 standard email followed by 1 cardiovascular-focused message, and the final group received the reverse order. The messages emphasizing cardiovascular health illustrated that the flu vaccine offers protection for the heart and highlighted that studies have suggested a reduction in risks associated with cardiovascular diseases, heart attacks, and heart failure as a result of getting vaccinated. Despite the finding that the targeted email messages failed to enhance vaccination rates, This study represents an essential step in understanding how interventions similar to those conducted in Denmark can be successfully executed within the considerable framework of a large health system like Kaiser Permanente. Currently, it's noteworthy that fewer than half of U.S. adults opt for the annual flu vaccine. However, the flu remains a serious threat, resulting in over 40,000 fatalities among U.S. adults yearly, particularly impacting those with heart conditions and other cardiovascular risk factors who are most susceptible to complications related to the flu. Dr. Bott asserted that although their research did not yield improved vaccination rates from the email campaigns, it did affirm that such large-scale studies are possible within the U.S. healthcare landscape. He expressed hope for the next steps, aiming to identify effective messaging that resonates more profoundly with the American populace, and to use the established framework for conducting further large-scale randomized trials that could ultimately enhance patient care. The study was made possible through the funding from the Kaiser Permanente Garfield Memorial Fund, showcasing a collective effort from various contributors, including several co-authors and members from both Kaiser Permanente and Copenhagen University Hospital.